Male hypoactive sexual desire disorder is the male lack of desire for sex and deficient or absent erotic thoughts or fantasies, persistent or recurrent for a minimum duration of approximately 6 months. Only less than 2% of men ages 16 to 44 experience a persistent lack of interest in sex lasting more than 6 months. To be properly diagnosed for the disorder, a person must have experienced little or no sexual desire over the entirety of his lifetime, or must have experienced low desire after a period of normal sexual desire for the minimum time. It is common that typical triggers of sexual desire decline with age, so counselors should take care in the diagnosis and treatment of this disorder. Factors that contribute to this disorder include that of temperamental, such as mood and anxiety, environmental, such as excessive alcohol use or social and cultural influence, and genetic or physiological, such as age and testosterone levels.
Treatment specific to medical intervention. What I would recommend for a client who has hypoactive sexual desire is to go to their primary care provider so then we can rule out any underlying biological issues such as with testosterone levels. As of right now, there are no approved drugs by the FDA to help with hypoactive sexual desire in men, so I would not recommend anyone to use a drug for this disorder, since all of them are going to be off-label and that can cause some issues. As with any disorder, try to reduce your stress, exercise more, and improve your diet so then you're eating healthier, just in case that could cause the hypoactive sexual desire. Treatment specific to psychological and emotional intervention. I would provide a detailed sexual history that examines the client's current adult sexual functioning as well as his childhood and adolescent sexual experiences, level and resources of sexual knowledge, typical sexual practices and their frequency, medical history, drug and alcohol use, and lifestyle factors. After doing this, I would recommend that the client assess his attitudes and fund of knowledge regarding sex, emotional responses to it, and self-talk that may be contributing to the dysfunction. Afterwards, I would explore the client's family of origin for factors that may be contributing to the dysfunction, such as negative attitudes regarding sexuality, feelings of inhibition, low self-esteem, guilt, fear, or repulsion. I would also assess the role of depression in possibly causing the client's dysfunction and treat if depression seems casual.
A study done of coupled heterosexual males found that increasing emotional intimacy will increase sexual desire. Machismo and the understood myth that men should always be ready to have sex is a great source of shame for those men struggling with male hyposexual desire disorder. Bringing the couple together to look at ways in which they both can work towards healthy sexuality decreases shame. Couples counseling is done with 5 basic components. First, the complete sex history of both partners is taken into consideration. Next, the counselor can educate and evaluate thoughts, emotions, and behavior in feedback sessions. Through this, the couple can learn a couple sexual style that suits their current lifestyle instead of romanticizing the good old days. Then, the couple must learn the good enough sex model. This model says that quote-unquote sexual perfection is not realistic. Finally, the couple continues therapy and behavior that will prevent relapse. Intimacy must be continued if the couple wants to encourage desire.
While there are many factors that contribute to the male hypoactive sexual desire disorder, it is important to note that one's worldview regarding self and others influences one's sexual experience. The fact that up to half of men with a past history of psychiatric symptoms may suffer from moderate or severe loss of desire confirms that sexual complications largely originate, directly or indirectly, from one's beliefs. These beliefs may include shame, fear, guilt, and despair. Sexual disorders in men are not widely understood, acknowledged, or treated. Simply knowing that someone cares about what they are going through can be the catalyst for change that most men are lacking. To effectively support someone suffering from this disorder, a counselor must understand the partnership between cognitive power and spiritual transformation. Counselors can help their clients identify the negative beliefs associated with their lack of sexual fulfillment by meeting their clients in their current state, by assuring them that they are not alone in their struggle, by encouraging a positive self-image through the theory of differentiation, and by recommending couples therapy to contribute to the team effort of affirmation. Thank you for your interest in the various treatments of male hypoactive sexual desire disorder.